Society's ongoing monthly educational program, and in an effort to educate the public more on renal health and to kind of raise awareness of the illnesses of renal disease, we decided to launch this program. Now, I want to start by kind of giving information on the Nevis Renal Society. It was founded in 1998 by, let me get these names right, by Alexa Pemberton, Dr. Glenville Liebert, Hensley Daniel, the Honorable, and Estella Challenger Gums. Now, these founders, they saw the need for more attention and more help to be provided towards the persons suffering from kidney disease and other kidney ailments, and also kind of to provide financial assistance to them, because we know this is a very tough situation, and also to help the family members and caretakers gain more information and be able to better take care of their loved ones. Now, you know, in an effort to improve their lives, the Renal Society, we raise funds. We do a lot of outreach, and we raise funds to help these individuals either pay for their dialysis bills. We just provide kind of social events for them to know that we appreciate them. And the ultimate goal of the Renal Society is to establish a dialysis unit here on Nevis. Now, this is a big task. As I said, they were founded in 1998, and this is 2024, and we still aren't where we want to be. But folks, I'm just putting it out there. We always are welcoming sponsors. We're always welcoming donations to help us reach this goal. Now, in order to get started tonight, before we start, I want to give a shout out to the sponsor, Nurse Cherise Harvey. Thank you. We want to show your appreciation for making these sessions possible, and these sessions will be going on every third Thursday of the month. All right, so for now we only have enough sponsorship to do this every month, but if I'm just shouting out to all those out there, if you want to hear these talks more often, or if you kind of want to give a donation out to the Renal Society, you could always reach me at 669-9585, and I will direct you to the appropriate sources. Now, okay, let's get started. So I want to start today's session by kind of giving the general overview of the kidneys. What are the kidneys? Where are the kidneys? And what they do? Now, the kidneys are often an overlooked organ, but their significance is, it's great. It's a very great significance. These organs play a part in regulating the body. Now, the kidneys are two bean-shaped organs located in the back area, just below your last pair of ribs, and they come in pairs, one on the left, one on the right. Now, each is about the size of your fist, with the left being a little bit bigger than the right. So, the kidneys now, they function, they're shaped like a bean. I forgot to mention that. That's how you get the bean called the kidney bean. So, function. Now, the kidneys function to basically remove waste from the body. And they also function to regulate the water content in the body. Now, in regulating the waste and the excess water, that's what we excrete as urine. Now, the kidney, in regulating the water and the waste, if you have urine that is concentrated, a little water is passed in that urine, that's why you get that deep yellow color, or grades of that yellow color. And when your urine is dilute, or there's a lot of water in your body being passed out by the kidneys, you get a clear, transparent urine. Now, also the kidneys also manage electrolytes, the electrolyte balance in the body. Now, we know electrolytes are important for normal functioning of the body. These are things like calcium, sodium, chloride, potassium. Now, these little electrolytes, they help normalize body functions, and the kidneys regulate how much of these electrolytes the body keeps or excretes. Also, the kidney functions in hormone creation. Now, two main hormones the kidneys create help in one, blood pressure regulation, and also in creating red blood cells. Now, that's the major component of blood, we all know. That's what gives it the red color. So, just to stress the importance of these kidneys now, imagine such an organ that's located at the back, something we don't normally think about, something that we just, mostly take for granted. Now, this organ helps keep the water balance in the body. Without it, we might either be too full of water or too dry from lack of water, or just the uncontrolled excess excretion of water. Also, the maintaining the waste to normal product ratio in the body, in that if the kidney wasn't there excreting this waste, all these toxic products would be building up in our bodies, and our organs, our bodies, our minds wouldn't be able to function as they do. So the kidney, very important in excreting that waste. Now, if you imagine the streets of Charlestown, Nevis, no garbage collectors collecting the waste, no toilets, no septic tanks, anything like that. Imagine all that waste just running out into the streets, piling up and piling up and piling up. It would choke the town. And in that sense, that's the same thing like the kidneys. They deal with that waste. They remove that waste from our bodies, keep the streets flowing, keep the body flowing as it should. Also now, with the electrolytes, if the kidney wasn't regulating these electrolytes, we wouldn't be able to do things like have our heart beat, move our muscles, think. We need electrolytes to do all these little things that we don't think about, and the kidney helps maintain that balance. If we had too much potassium in our blood would become toxic, and our hearts would basically go into dysfunction. If we didn't have enough calcium, we couldn't move our muscles properly. If we didn't have enough sodium, our brains wouldn't function properly. The kidney is responsible for maintaining all of these small little fine details that we don't think about on a daily basis. And that's just another important function of the kidneys. I haven't even touched the hormones yet. Now imagine if the kidneys weren't producing the hormones they were to control your blood pressure. Your blood pressure would be out of control, sky high. Now imagine that, and your body wouldn't be functioning how it should. Your heart would be under strain, your brain would be under strain. Different effects would be affecting the body. And importantly, the kidney's hormonal function in producing red blood cells, which we use to transport oxygen around the body, and also the blood itself in general, transporting different solutes, water, medium, all around the body to places where they need to go. Imagine if the kidneys weren't working and we couldn't produce blood cells to carry out the simple function of carrying the oxygen to where it needs to go. We'd be poisoned. We wouldn't exist. And that's just to emphasize the importance of the kidneys. Now imagine all of that from just a small organ the size of your fist, and imagine persons out there who are undergoing kidney failure or renal disease. That's basically the function of dialysis. Dialysis helps them filter the waste, helps them regulate the balance of water and electrolytes in their blood. They can't do that how someone who doesn't suffer from kidney disease can do that. And that's why it's so important that persons suffering kidney disease, they do their regular dialysis, they maintain a balanced diet the way that they should. They can't drink too much water, alcohol, cut that out, protein has to be reduced. It's a fine line when you're on dialysis and when you're suffering from renal issues, and it's a very, very difficult struggle. I mean, just like I said, kidneys kind of function in blood pressure regulation and creating the red blood cells. Persons who have renal issues or renal disease, they have to take blood pressure medication religiously to maintain that pressure as it is, or else it would be a runaway effect. And they also have to take a medication to help them make red blood cells. Now it's a very, very difficult situation, when you're suffering from renal disease. And that's why we at the Renal Society see the importance of having these educational sessions, getting the message out there to the public, to persons suffering from this illness, to persons who are taking care of others with this illness, or just have someone in your family with this illness. It's always important to know the different aspects. So in these sessions, I will be teaching different elements of maintaining kidney health and maintaining regular diet, medication, water balance, all of these things. And you're going to see me for a long time going forward. I promise that. So, I want to open up to any calls or questions from the listeners out there. This is the time to, call, get in some questions, anything about renal health or just health in general. I'm right here. Okay, so to keep going, kidney health and the Renal Society. We could always use some more sponsors out there. To anybody listening, anybody who, they have kind of an affection or they want to help the situation any way possible. You could always reach out to us with a little sponsorship. A little bit goes a long way. And if you want to get that dialysis unit up and running in Nevis, so our brothers and sisters don't have to travel all the way to St. Kitts for treatment. You go to treatment some twice a week, some 3 times a week, and it's not cheap. So if you want to help, always we're here looking for donations, looking for sponsorship. And the lines are open for anyone who wants to call in and ask a question or give a statement, a testimony, anything. So, again, renal health. I just want to kind of, give some information on the next event that we at the Renal Society is having, and that is a cocktail dinner. So we're going to be hosting our cocktail dinner at the Malcolm Gishad Park on December 7th from 7 p.m. to 10 p.m. Tickets are available. They're only $150 EC. All the proceeds will go to helping our clients and furthering our goal to building a dialysis center here in Nevis. Now, we want you to come out, have fun, listen to great music, enjoy great food with great company. This is a good opportunity to dust off those gala gowns, dust off those tuxedos, dust off those jackets, the suits. Come out, have fun. Let's go. So renal health. The next session we're going to have the 3rd Thursday of every month. Next session I'll be talking about common diseases that affect the kidneys and how we could maintain better kidney health. Everybody knows it's important to do your yearly checkup. If you're suffering from any illness, a more frequent checkup might be important for you. We could also do something maybe like once every 6 months, once every year, at least a year, have a checkup. Make sure you include your kidney panel in that checkup. Okay? So, ever since I joined the society, it's been great. We've done many events, the Nevis Renal Society, and I would say it's one of the most effective, most caring, most compassionate, and most outgoing charities and organizations I've been involved with. I really see the care going on at the Nevis Renal Society, and I'm proud to be a member. See, tonight I'm wearing my shirt. I don't know if them on the live could see me wearing the Renal Society shirt from the walk today. You see that one? Alright. It says, love your kidney, love your life. Right. So your last, I don't remember which month it was, but we had that renal walk, the annual walk we do. It was great. We went from Beach Road all the way over to the Heritage Village, and the people came out in their numbers, the masses. It was just a sea of white shirts going all the way across. We went up into Zetland's area, into Rollins down that road, and I really broke a sweat with that one. I ain't even gonna lie, I broke a sweat. I made it to the end, and I actually won in the raffle that they had. So I won a spa treatment. So it was a good time, and I enjoyed that gift as well. So guys, we're here, part of the Nevis Renal Society. We're trying to raise awareness. We're trying to educate others out there. Anyone want to call in, give a testimony, call in and ask a question about your kidney health or any other health question in general, feel free to call Van Radio. Again, we're going to shout out the sponsor, Miss Cherise Harvey, Nurse Cherise Harvey. She is the one making these sessions possible, and just want to show appreciation for that. And anybody else out there who wants to become a sponsor, feel free to contact us at the Nevis Renal Society, and we could get these sessions going from once a month to hopefully every week. Every week we want to go out there and kind of put our hands out there, reach out to the public, give advice, figure out anybody's situation. Because if nobody speaks out, nobody knows. And we need more people to be more active, more vocal, to kind of get the message out there and show the importance of what's going on, and maybe changes could be made that way. But if nobody speaks, there's no changes.
I have a question. What are some of the symptoms that persons can check for with regards to early signs of renal failure?
Okay, so if there is an enlargement or what we call an infarction, being a lack of blood supply going to the kidney, you would feel a pain either in the back or on your side. So that would be an early sign of something going wrong with the kidney. A sharp or dull pain, crampy pain in your back or directly in your side, on either side, left or right. Also, persons who the kidneys aren't functioning well, they have a backup of a byproduct called creatinine. Now that comes from the breakdown of protein. The kidneys functioning, kind of filtering that out back into the blood, out of the blood, sorry. Now if you have a buildup of creatinine, you might experience lethargy, a feeling of sickness, general unwellness, something that you can't explain. It's not a viral illness or a bacterial illness, but you just feel sick for some reason. You feel tired, unwell, something like that could drive you towards the doctor. Or maybe if you're experiencing a lack of, your urine is less than it normally is, even though you've been drinking, you find that your bladder is distended, your abdomen is distended for some reason, but you can't explain it. It's not food, it's not fat, you just feel your belly swelling up. That's an indication that your kidneys might need a little bit of attention. Blood in the urine is also a big alarming sign that could indicate a far-on process or something acute, depending on how bad the situation is. Knowing your family history is also very important. There's some kidney diseases that are genetic, and they play out in families. They run strongly in families. So if your family member has kidney disease, you yourself should get checked for that disease as well. Just if it's a direct family member, your mother, your dad, your grandparents, somebody like that. Also, high blood pressure is a big early sign of kidney disease. Remember, the kidney controls the blood pressure in the body. So if you find that your blood pressure has just been raising, high randomly, when you say randomly, it does that, but that's an important step when you find a patient with hypertension. You want to check and see how the kidney is doing. Is that blood pressure high because the kidney is undergoing some kind of stress or illness? And that's a direction you should go in. Especially if you have hypertension, you check your kidneys at least once a year to see if the kidney is the cause of that hypertension.
And if you as the doctor diagnose early signs of renal failure, is there some type of way to prevent further onset or to reverse what is already there?
Okay, so some of these illnesses, it's a textbook full. I mean, we could go from the roof of this building to the bottom of the ocean in how much kidney diseases there are. And they're broken down into about 3 different phases, where one phase is what we call pre-renal, in that some of these illnesses, they could be reversed or they could be halted in that phase with, whatever treatment there is. Some of them, they require medication, others require a change in diet, some require both. So depending on the illness, if it's in that phase, we could halt it in that direction and even reverse certain things. Some things we unfortunately can't do anything about except to just halt them in whatever phase they are in, especially if it's something gone a little bit too far into a stage 5 or stage 4 renal disease. And then other things that might affect the kidney couldn't even be the kidney. They won't even be something like prostate. Now, if a male has an enlarged prostate and it's kind of blocking off the urinary tract, that would cause a backflow of urine into the kidneys and cause them to swell and not function how they should. Now, if they manage that prostate issue, then the kidney issue would fix itself. So it depends on the illness and it depends on the patients as well. You got to take that into consideration. Every patient is different. Every disease might be different in a patient. So you always consider the patient when treating them for any given illness. So we're still looking out for callers, commenters on the live, in the station. We're coming up to that hour where we might have to say goodbye. It's only 30 minutes, but I hope it's 30 minutes well spent, because this information is priceless and some people actually want to put a price on it. So we're giving it to you here on Van Radio for free in collaboration with the Nevis Renal Society. Alright, folks. Okay. Well, I want to just say thanks to everybody for putting this initiative together. Thanks to the Nevis Renal Society, of course. I want to thank the sponsor again. This is how grateful we are just for the giving spirit that this lady had, Nurse Cherise Harvey. Thank you very much for helping make this thing happen, and thank you to Van Radio for having us. Don't forget, December 7th, we are at the Malcolm Guichard Park from 7 p.m. to 10 p.m. We are hosting our end of year cocktail, and we want to invite everyone to join us. At this cocktail, we will be showing our appreciation for some past members and also for some current members of the Nevis Renal Society and those sponsors that have been with us for years, giving tirelessly, putting the effort in. So it's a night of appreciation, it's a night of fun, it's a night of togetherness at the Malcolm Guichard Park on December 7th from 7 p.m. to 10 p.m. The tickets are only $150 EC, not US, EC. So for something so prestigious, I've said that's a good price, more than good price. Alright, so thank you to the listeners out there. Thank you to those on YouTube, on Facebook Live. Thank you to those on the radio listening faithfully. It's a great honor to be here to present this information. This is something I always wanted to do with my life, and it feels great doing it. So thank you for being present. Thank you for the opportunities. And I'll see you guys next month, 3rd Thursday of every month. We are here giving out the information, listening. For anybody who want to come in and comment, just call, give a word of encouragement, give a shout out to somebody, suffering from any renal illness. Remember, y'all, the ultimate goal is to get that dialysis center up and running in Nevis. Our people deserve it, and we're going to make it happen regardless. So thank you guys, and good night until next month.
You were just listening to Health Talk, sponsored by Nurse Cherise Harvey in collaboration with the Nevis Renal Society.